So what is bed shampoo? The hair may be shampooed for cleanliness and comfort if a patient has undergone a prolonged hospitalization. The purpose of this procedure is to stimulate blood circulation of the scalp through massage. That's why when we are doing the bed shampoo, we need to massage the scalp of the client. Second is to clean and increase the client's sense of well-being. Also, some clients cannot safely leave their beds. That is why it is our responsibility as a nurse to do it. So the equipments that I will be using are hair comb or brush, plastic sheeted pad, two bath towels, shampoo, basin, wash water pad, back blanket perceptible for the shampoo, water, cotton balls, pitcher of water, bath thermometer, liquid or cream shampoo, and the hair dryer. So, in performing bed shampoo we are guided by the following guidelines. First, is to confirm doctor's order, because sometimes the bath order may have changed. Also, we need to check the client's identification and condition. The next thing that we have to do is to greet our client and also establish rapport. We need to ask them about their personal hygiene preferences and their ability to assist with the procedure.
Good day everyone, this is Shaira Delete, your student nurse for today. So today, I will be performing bed shampoo. For the initial procedure, I have to greet first the client and validate some information about him or her. Therefore, in validating information, we have to observe the wristband of our patient and also ask the patient to state his or her name as well as his or her birthday. Good day sir, I am Nurse Shaira. May you please state your name and your birthday?
JP Adelaide. My birthday is on February 6, 2000.
So how are you feeling right now, Sir JP?
I feel good.
Okay. Next step is to explain to the client what you are going to do, why is it necessary, and how he can cooperate. So today, I will be performing the bed shampoo. I'm going to do that because the doctor said to do that because you are unable to get out of the bed and it's been a little while since you have your hair washed. So this is necessary to remove dirt and oil buildup in your hair. So can you help me in performing this procedure?
Okay, nurse.
After establishing rapport, we need to prepare all the equipments that we need for the bed shampoo. So I have all my equipments here already. We need to remember that prior to giving bed shampoo, we need to perform hand hygiene. Of course, don our gloves, but this is optional. So after donning our gloves, we are also reminded a few more things. So if there are any curtains or any doors here, we need to close them in order to provide warmth and privacy to our patients. With that, you may now proceed to the next step, which is to get our basin that is full of water, and we need to let our client to check the temperature of the water if it is tolerable for them.
We may now proceed in repositioning the client.
So now, I'm going to position my client diagonally in order for him to prepare the shampooing so that the client will feel comfortable and appropriate. So I will remove first the pillow and arrange my equipment so I can do it in a better way. The next step is to put on the waterproof pad under his head so it can protect the bed from getting too wet.
We may now proceed in preparing the client.
I already arranged my equipment and I already put the waterproof pad under my client's head to avoid wetting the bed. If your client is a girl, remove pins from the hair. However, since our client here is a male, he does not have any hairpins or anything. Still, I'm going to brush the client's hair thoroughly to remove the tangles.
We may now proceed to the placement of Kelly pad.
So next is to place the Kelly pad under the client's head with the neck hyperextended. So in this case, we don't have the Kelly pad, but still, we are going to use this water basin as it provides this Kelly pad. So if you're using Kelly pad, make sure that the throw of the Kelly pad should be directed to the basin so that it will collect the water and there will be no too much foliage on the floor.
Proceed in protecting the eyes and ears of the client.
Now, I am going to cover my client's eye with a washcloth to prevent eye irritation from the shampoo. Then, I will plug cotton balls to the ears to prevent water into the external auditory canal. So now, I'm going to pour water on my client's hair until it's totally wet, and also it's good to tell the patient that you are going to rinse it already so that there is no shock from the cold water. Okay sir, I'm going to rinse your hair na po.
Proceed in shampooing the client.
After that, we should apply a little amount of shampoo and also you can put conditioner if desired by the patient. After putting shampoo, we should massage the scalp using the fat pad of our fingers to reach lather. Also, massaging the hair promotes circulation of the scalp, which enrich or help the blood circulation. So, we must reach lather because it ensures thoroughly cleansing of the hair and make sure that every part of the hair are being shampooed.
Proceed in rinsing the hair of the client.
So if you are using Kelly pad, it is way easier because it is less messier than using the basin. Since I already rinsed it well, I will now remove the water basin. Next, I will use towel to make a turban in order to wrap my client's hair, so I will wrap this around here since it is still wet. I will now remove the washcloth from his eyes and remove the cotton balls from his ears. So now, I'm going to remove the waterproof pad and put the pad in the hamper. After that, I'm going to remove the gloves that I used. So now, after doing everything, I will dry my patient's hair using dryer or electric fan.
Proceed in repositioning of the client.
After drying my client's hair, I will remove the towel that I wrapped on his hair and put this on the hamper. So now, I'm going to reposition my client in a comfortable position and I will also put back the pillow under his head. After I reposition my client, at this point, I'm going to clean up my equipments by discarding soil towels and put this on a container, then clean all the basins that I use, and after that, I will record or document my findings on the client's record book.
So after performing all the steps in bed bathing, we have to make sure that the client is comfortable before taking them to sleep. After this, we need to do our document.
So JP Adalid, 21 years old, done doing his bed bath shampoo. So there's no problem and his hair are already good.